Thyroid cancer in teenagers and young adults is relatively rare compared to older populations, but its incidence has been increasing in recent years. This demographic is primarily affected by differentiated thyroid cancers, particularly papillary thyroid cancer, which is the most common type of thyroid cancer overall. Understanding the characteristics, symptoms, diagnosis, treatment, and prognosis of thyroid cancer in this age group is crucial for effective management and support. Overview incidence. While thyroid cancer is uncommon in adolescents and young adults, it is the most prevalent endocrine cancer in this age group. The average age of diagnosis tends to be in the late teens to early 20s. Types of thyroid cancer. The most common types diagnosed in teenagers and young adults include papillary thyroid cancer, the most prevalent form, known for its slow growth and favorable prognosis. Follicular thyroid cancer, less common than papillary cancer but may be more aggressive. Medullary thyroid cancer, the rarer type that can be hereditary. Risk factors. Several factors may contribute to the development of thyroid cancer in this age group. Family history. The family history of thyroid cancer or genetic syndromes, e.g., multiple endocrine neoplasia type 2, can increase risk. Radiation exposure. Prior exposure to radiation, particularly to the neck area, e.g., from cancer treatment, is a significant risk factor. Gender. Thyroid cancer is more common in females than in males, particularly in younger age groups. Iodine deficiency. Though rare in developed countries, low dietary iodine can increase risk. Symptoms in teenagers and young adults. Symptoms of thyroid cancer may include neck lump. The most common initial sign is a palpable nodule or lump in the neck, often painless. Changes in voice, hoarseness or voice changes due to pressure on the vocal cords. Difficulty swallowing. Larger tumors may compress the esophagus, causing swallowing difficulties. Swollen lymph nodes. Enlarged lymph nodes in the neck can indicate spread of cancer. Persistent cough. A cough that does not go away, particularly if it is unrelated to a respiratory infection. Fatigue and unexplained weight loss. General symptoms that may occur with more advanced disease. Diagnosis. Diagnosing thyroid cancer typically involves the following steps. Medical history and physical examination. Healthcare provider will assess symptoms and perform a physical examination of the neck. Imaging tests. Ultrasound, used to evaluate the characteristics of thyroid nodules. CT or MRI scans may be used for further evaluation if there is suspicion of spread. Fine needle aspiration biopsy (FNA), a procedure where a thin needle is used to extract cells from a thyroid nodule to check for cancerous changes. Blood tests. While there are no specific blood tests for thyroid cancer, measuring thyroid hormone levels can provide information about thyroid function. Treatment. Treatment for thyroid cancer in teenagers and young adults typically involves surgery, total or partial thyroidectomy. Most patients will require surgical removal of all or part of the thyroid gland. In cases where cancer has spread to lymph nodes, a lymph node dissection may also be performed. Radioactive iodine therapy, often used after surgery to eliminate any remaining thyroid tissue or cancer cells, particularly in papillary and follicular cancers. External beam radiation therapy may be considered in certain cases, especially for more aggressive tumors or if the cancer has spread. Targeted therapy. For advanced medullary thyroid cancer or other aggressive forms, targeted therapies may be considered based on specific genetic mutations. Prognosis. The prognosis for thyroid cancer in teenagers and young adults is generally favorable, especially for papillary thyroid cancer. High survival rates. Most patients diagnosed with differentiated thyroid cancer have high survival rates, often exceeding 90% for early-stage disease. Long-term follow-up. Regular follow-up is crucial to monitor for recurrence and manage any long-term effects of treatment, particularly for those who undergo total thyroidectomy. Emotional and psychological support. A cancer diagnosis can be challenging for teenagers and young adults, both emotionally and psychologically. Supportive care may include counseling and support groups. Access to mental health resources and support groups can help individuals cope with the emotional aspects of diagnosis and treatment. Education and awareness. Providing information about the condition, treatment options, and long-term outlook can empower patients and their families. Peer support. Connecting with other young people who have faced similar challenges can provide a sense of community and understanding. Conclusion: thyroid cancer in teenagers and young adults is a significant health concern that requires prompt diagnosis and treatment. With appropriate medical care, the prognosis is generally very good, especially for differentiated thyroid cancers. Awareness of symptoms, risk factors, and the importance of follow-up care is crucial for effective management and support. If you or someone you know in this age group is experiencing symptoms or has concerns about thyroid health, consulting a healthcare provider is essential for timely evaluation and intervention.